Welcome to the safety plan training using the Stanley Brown Safety Plan. The Stanley Brown Safety Plan can be utilized for suicidal or homicidal ideation, crisis planning, and relapse prevention. There are different sections of the Stanley Brown Safety Plan you need to be aware of, and you need to make sure that we are looking at filling out for the entire plan. So step 1 is warning signs. Step 2 is internal coping strategies. Step 3 are people and social settings that provide distraction. Step 4 are people whom the client can ask for help during a crisis. Step 5 is the professional or agencies the client can contact during a crisis. And step 6 is making the environment safer, a plan for lethal means safety. So step 1, warning signs. Some of the common warning signs you may hear are things like decrease or inability to complete daily tasks, rapid mood swings or changes in energy levels, an increase or even a decrease in alcohol or substance use, abusive behavior to self or others, witness to violence or trauma, losing touch with reality or paranoia, suicidal or homicidal ideation, sense of utter hopelessness and helplessness, any type of history of suicide attempts or other self-harming behaviors, and even a history of family or friends suicide or attempts. So some of the most frequent mistakes that we see on not capturing the information we need. So we want to always be assessing our clients for warning signs. The client may or may not tell you that something's going on. So we always want to be trying to, evoke that information from them during our sessions. And if we notice warning signs, it is okay to say, hey, it seems like you've got some stuff going on. Let's go ahead and take a look at your safety plan, or let's go ahead and take a look at maybe developing a safety plan. Step 2 are those internal coping strategies. So some of our common coping strategies you may hear are things like people like to go for walks, exercise, read, watch TV, or watch movies. They may clean, they enjoy playing with their pets, creating art, or completing a project. So some of the things that we want to think about are we don't want to leave this section blank. So if you're trying to help someone develop a safety plan, they may not be able to think of anything in the moment. So you can throw out a couple examples, which can lead to other things they may think about. So we definitely don't want to leave this section blank. We definitely do not want to document none or I don't know. We want to use more assessment questions to get a good answer. And then also we might need to ask other questions. For example, we cannot utilize coping strategies in all settings. So we might want to think about what is the client, what obligations do they have? If they're a parent, we're going to have to try to find internal coping strategies that they can do while they're parenting. If they're working, we're going to have to try to find internal coping strategies they can do while they're at work. So there's kind of a lot to think about there. And then we will have step 3, people and social settings that provide distraction. Some of the common answers we're going to hear are things like friends, relatives, a spouse, coworker, someone else's home, a park, movies, shopping, work, partners. And some of the frequent mistakes that we'll see are things like not filling out the section, again, documenting none or I don't know, and not asking enough questions. So one of the things that we really want to do is identify, who would you go to first? If they're not available, who else would you might be able to go to? And remember that we are also wanting to explain to the client making sure that they understand this is not necessarily someone that you are going to for the purpose of, getting some type of emotional connection or help with their mental health, but just someone that can provide distraction, or a social setting that can provide distraction. So we might have to be more concrete in how we explain what this section is about. So step 4, people who the client can ask for help during a crisis. Again, those common answers are things like spouses and partners, significant other, best friend, family member, coworker, even church leaders, or even acquaintances. And then some of the mistakes that we see on the safety plan are things like listing only one person. We really want to try to identify more than one person. We want to try to fill this out as much as possible. Also, if we document mom instead of mom and then capturing her name, we would really want to know, why were we unable to get the name? Is the client uncomfortable telling you their parent's name? But we really want to try to have that information. And then we really do need to contact the contact information and put that on the document. And part of what we really want to do is getting the client's investment in their plan. So asking them questions like, if you are going to utilize your friend or family member, do you have their contact information in your phone? Is it something you know by heart? Will you have access to your phone most of the time? Some of our clients will have phones and then they will end up getting a new phone and they will not have their contact information. So these are little conversations that we want to have with our clients as we're going along and as we're updating our safety plans. And then, of course, one of the things that we definitely don't want to do is document nobody. This is where we really need to pull out information from the client, keep asking those assessment questions, because in their mind, they may be thinking of the perfect person that they would go to, or the person they wish they could go to and can't. So we want to try to explain to them that, not everyone has, the person that they could go to, that they wish that person was. Maybe your parent isn't the person you would go to in a crisis. However, maybe you could go to your parent to ask for help during a crisis, but not necessarily help in the way that you wish they would, but maybe help get you to your therapist appointment or help keep you busy until your therapist appointment. So step 5, professionals or agencies the client can contact. And of course, we know that we want to have the clinician agency name and phone number, the emergency contact and phone number, our local emergency department. We want to include our crisis care center. We want to include those phone numbers like call or text 988, the suicide prevention lifeline phone number. One of the things that we see frequently is not filling out this section. Not checking to see where the client is located for the closest emergency department, or not asking the client's location preference for emergency department. So we want to make sure that we're not just putting the location that's closest to the office, but closest to where the client can access if needed. And also, part of the investment in their plan is asking them, have you ever utilized your local emergency department? Did you have a good experience? Did you not have a good experience? Find out, because many people will tell you that, if they've had a bad experience somewhere, they may not be likely to utilize that place again. So we want to try to find out, where they're interested and what they would be willing to do. And then being sure that we talk about these things during the session and making sure that the client has this information, again, written down, saved in their phone, asking them, where would you keep this so that you would know that you would be able to utilize it if needed? What would prompt you to do that? And just getting those extra questions asked to get more information. Step 6, making the environment safer. So this is the plan for lethal means. Some common clinical considerations that we want to think about are assessing for things like access to guns, knives, sharps, ropes, poison, access to medication or illicit substances, and we want to try to eliminate or reduce lethal means. So some of the things that we see frequently that we don't want to do is not documenting this section. The other thing that we want to really be very aware of is researching firearm transfer laws in your state. Sometimes if you're thinking about, how are we going to get a client to possibly give their guns to someone else, that may not be the best solution, because one of the things that you have to think about is that, in each state, there are laws about transferring firearms. So one of the things you may want to consider is that in those laws dictate things like not transferring a possession of a firearm from a client to a felon or to someone else that has mental health issues that may not be able to have a firearm. So if you do have a client that has guns, you may want to ask them, is there a way they can lock them up? If they are going to lock them up, possibly if there is a key or a combination, could they give that to someone else? That is better in this situation for the clinician and the client, than to ask the client if they'd be willing to pass their guns off to someone else. So we were thinking about that in terms of course, making the client safe is the number one priority, but also staying within the scope of our ability and using our ethical guidelines. So some of the resources that you may want to look up are listed on this slide. NAMI.org is a very good resource for not just clinicians, but also for your clients. They have a full crisis planning section that can be utilized by your clients. It shows all of these warning signs and more, help your client and family understand crisis and how to deal with crisis. You can also go to some of these other websites and also go to the Stanley Brown Safety Plan website, and that has more information on the Stanley Brown Safety Plan, particularly when you're using it for suicidal ideation or homicidal ideation. And it will give you more information on things like how to explain the purpose of the safety plan to the client in terms of utilizing for any type of suicidal ideation. We will have more resources for you for crisis planning, but I just wanted to stop and say thank you for attending and thank you for utilizing this training resource, and I hope you found it useful.